So I did mine on influenza. So influenza is also called the flu. It is an acute infection of the upper or lower respiratory tract. It causes fever, chills, weakness, and pain in muscles. And this is just a diagram of what your cells might look like for influenza. So the subtypes, we have influenza A. Influenza A is the only virus to have a flu pandemic. And then you have your influenza B, which is classified into two lineages. Right here, we have influenza B lineages. You have B Victoria, and then B I cannot say this word, Yabgata. And then it's clades groups, which are these ones, which is what the linear is subdivided into. And then you have your subclades, which your clades subdivide into. Okay, so now we have your influenza C. Influenza C is a mild illness and does not cause flu epidemics. And then you have influenza D, which is influenza that can be in animals, like it's primarily in cattle and sheep and just like farm animals for me. Okay, now you have your immune cells that are involved. So you have your NK cells, which are your natural killer cells. You have your B cells, and B cells make antibodies. Then you have your T cells. T cells, they tag other cells. Then you have your macrophages. Macrophages, they phagocyze the infected cells. And then you have your monocytes, and this is the blood from a macrophage. And then you have a little diagram up here that just explains everything what immune cells are involved, like your Y and T cells, macrophage, NK cells, dendrites, and those, and then the dendrite cell. Okay. So now we have your lymph node organs involved. Your lymph node organs that are involved is your lymph node tissue that drain the respiratory tract and your mucosal associated lymph organs. And then this is a nice picture here that shows you the influenza infection of the lymph organs. Okay, so now the causes. The causes is basically it's motor transmission, and it's by droplets. Through sneezing and coughing is mainly when people can be contagious with influenza. And it's contagious and it can spread very rapidly. And this is a nice picture just showing symptoms, and it's caused by viruses, snuffy nose, coughing, sore throat, respiratory infections, and then symptoms and stuff like that. It's a nice picture just to identify the difference between a cold and influenza. Okay, so now risk factors. Risk factors is huge for people. Like the COVID, there's so many risk factors going on right now. And now it's similar to influenza, but it's not the same. So risk factors is elderly, 65 years and up, can be super contagious. Under the age of 5, upper respiratory problems, diabetes or HIV. Pregnant women are very, very prone for influenza, asthma, and cancer. So there's the main risk factors. And then this picture down here is just showing you different patients. This one's hospitalized patients, infants, elderly, pregnant women, and diabetes and heart problems. Symptoms. So like I mentioned earlier when I described what influenza was, now we're going to go into more depth of symptoms. So symptoms are muscle aches, so if you're sore in your body, it might be a symptom. Headaches, or people often call them migraines or headaches, yeah. And then congestion, so stuffy nose, fever, chills, it's like you shake, sore throat, runny nose, and malaise, which is the feeling of not wanting to do anything. I can't say that word, but it's just your feeling of you just don't want to do anything, you don't want to get out of bed. It's basically what that is saying, and weakness. You're just too tired. So the diagnosis is through PCR testing, which PCR testing is your polymerase chain reaction. It takes the viral DNA and multiplies it for molecular detection. And then it's also sometimes just diagnosed with just the symptoms. Like you can come in with half of those symptoms I just said on the other slide, and they can be like, yep, you have influenza, and they'll give you medication and stuff. And there is a test that can determine seasonal flu viruses for type A and B. And this is just a picture of influenza in the lungs. So treatments. Best treatment is bed rest, sleep, sleep, sleep. And then you have your Tamiflu, which is an antiviral usually used for elderly but doesn't always work for most people. Ingestion of more fluids. More fluids is going to help you get rid of it faster, the infection. And then use of analgesics to control fever, which is just a type of medication. And then also anti-nausea medications to help you not throw up as much. So progressions of the condition is you can get pneumonia in the lungs, pneumonia, viral or bacterial. And then if you don't get pneumonia, you will be prone to it, especially as you get older. So if you don't get it pneumonia right away, you'll probably get it as you get older for sure. And then you have your cardiopulmonary conditions in pregnant women and elderly. If I didn't explain what prognosis is, it's just after you have influenza, the flu, this is what outcomes you'll have eventually after you have it. And then you have respiratory pathogens and strands are always hanging and becoming stronger. And then you have your neurological diseases that you can get. So some complications or risk factors are flu can worsen long term. You can be hospitalized. Congestive heart failures, when your heart fails, you don't want to have that. Sinus and ear infection, and hospitalized. So some interesting information I found when doing my research was I didn't know that influenza D is in pigs and cows and sheep. I didn't know that. I just thought it was another form of influenza that we can get. I didn't know that it could be in animals. And then I also found about 8% of the U.S. population gets sick from flu each season, which is a high percent number if you're thinking about influenza. And then it takes up to 4 weeks for the flu vaccine to work. So a lot of people go in and get the influenza flu vaccine, and to me, I don't know, it takes 4 weeks for it to actually take place, which is a long time. And then flu season is only in fall and winter. And then this picture right here is each year the flu is linked to 200,000 doctor visits, 1,000 hospitalized, and up to 300 deaths, which is, to me, is crazy. And then here are my sources. And then that is my presentation on influenza.